All right, good morning, everyone, and thank you for joining us. Today is Monday, May 4th. I'm Dr. Allison Auerty, the Commissioner at the Chicago Department of Public Health. And as always, we will be talking about what's going on with COVID-19 here in Chicago, answering your questions. So as you can see, we have a guest with us today. This is Gia Biaggi. She's the Commissioner at the Chicago Department of Transportation. So just to get people start thinking about the questions, why don't you tell us just a little bit about what the Department of Transportation does and what you do?
Great, and thank you, Dr. Auerty, for having me here and for reminding me what day it was. I'm sure we're all trying to remember what day. It's Monday.
Yep.
So happy Monday. Yeah, so at the Department of Transportation, we have a really broad set of activities and infrastructure that we both manage and create policies around. Mm-hmm. So your streets, your sidewalks, your bridges, all the street signs, traffic signals, all of those are things that we manage and we make improvements on throughout the city. But other things like your Divvy bike share system, that's a great example of a program that we operate. Divvy is the city of Chicago, and we bring on contractors to operate that help people get around the city. So we're a big part of the conversation with our friends at the Chicago Transit Authority. How do we make it possible for buses to move around? Our job is to get you from where you are to where you want to go on one hand, but also to make sure that your streets and your sidewalks are great places to be. So we have this role to play both in making sure that everyday movement can happen, but that we also are creating great neighborhoods through what we can do.
All right, perfect. So we will come back and talk about how COVID-19 has impacted that. But in the meantime, go ahead and start putting in questions for Commissioner Biaggi, for me. You can put them in the box on Facebook. You can send them in under Twitter, hashtag AskDrAuerty, and I will go ahead and do a data update like we do every day, and then we'll come back, have a little more conversation about transportation and COVID, and then get into answering your questions. So first of all, for the data update. So as always, your first stop should be chicago.gov/coronavirus, and that is getting updated every day with all kinds of information. But right up at the top, there is a tab that says latest data and reports, and you can go there and get the latest data for the day. You can get the maps that we update. You can get the hospital data. You can get into the data portal and play with the data yourself. So as far as where we are, we hit one pretty important milestone just in the last 24 hours, and we'll hit another important milestone in the next 24 hours. So first, I'm really sad to report that we have now crossed 1,000 COVID deaths here in the city of Chicago. So we are now at 1,014 people who have died of COVID-19 in Chicago residents. And we are at 24,980 lab confirmed cases. So the other really benchmark that we'll hit by this time tomorrow is we'll be at 25,000 lab confirmed cases. So both of these really, significant, and obviously when we talk about these numbers, every one of them is a person and a family, and really, this continues to impact Chicago, all of us, in terms of staying at home and thinking about the economic piece. But for these 25,000 people, and especially for the friends and family of the more than 1,000 people who have died already, it's had an even more immediate impact. That was an increase of 1,093 cases and 27 deaths since yesterday. We continue to see that curve flattening, like we talked about yesterday, but we are on Saturday, but we are not yet on the downward trajectory, and we need people to continue to abide by the stay-at-home order. We know when the weather's nice, going out, getting some sun in a way that is socially distanced and appropriate is good, but we are not over this yet, and we need people to hang in. The almost 25,000 cases we have in Chicago are among 61,499 that have been reported in Illinois, and the 1,014 Chicago deaths are among 2,618 in Illinois. We've now had cases in 97 of Chicago's 102 counties. Our testing numbers continue to go up. So our 7-day average, I'll just remind you that as opposed to reporting out on a given day how many tests are done, we look at how many have been done over the last 7 days, because particularly on weekends, we see the number of tests done drop a little bit. Our 7-day average is now at 2,804 people getting tested per day on average here in Chicago. That's good. That's going up quickly. Still not where we need to be. Big priority for May is getting those testing rates even further up. Our cumulative percent positivity, meaning what percentage of all of the tests that we do are positive for COVID-19, here in Chicago is at 28%. So between sort of 3/4 and 4 and 5 of the tests that we do are actually between 3/4 and 1 in 3 of the tests that we do are positive at this point. And we'll want to see that number come down. That number comes down as our cases go down and as our testing goes up. So those two together will be a piece of what we're seeing. And then I thought maybe, because most of the time we'll spend talking about transportation, I thought I would just highlight one of the pieces of data that is on our daily report every day, but we don't always talk about so much, and that is our syndromic surveillance data. So maybe let's go ahead and pull up the graph, and while we're pulling it up, I'll just explain what this is. So all the time during flu season, the Chicago Department of Public Health tracks what's called syndromic surveillance. And if we break that down, syndromic means the syndrome of how people present to emergency departments. So a syndrome with fever or cough or generally feeling bad that can go along and look like influenza. So an influenza-like illness, we call it, or ILI. And of course, COVID presents very similar to how flu presents. And so people come with fevers and cough and it kind of look like influenza-like illness. So we've been tracking influenza-like illness and the percent of visits that we see to emergency departments, regardless of whether people get tested, regardless of whether they think they have COVID. It's sort of a real-time way for us to get a sense of what's going on across the whole city related during normal times to flu and now during COVID. So if we look at these two graphs, on the top here, the two in blue, this shows the percent of emergency department visits that we have due to influenza-like illness, or really COVID-like illness also, in Chicago among all of our age groups. So in the lighter blue here on the bottom, that's our 2019 data. And so you can see that back in January, if you kick along here, you know, in 2019, we were seeing around 20 to 30% of our visits every single day being due to influenza-like illness in January, because that's flu season. Now in 2020, we were already having a bad flu season. So you can see that in 2020, even before COVID, we were seeing like 40% more, 30 to 40%, sometimes kicking up to 50%. But then as we start to get into February, you know, really consistently running higher and for a longer time than we would expect. A lot of that is COVID, probably, on top of what would have been a flu season. But then you can see starting in April, we do start to see that darker blue 2020 line start to trend down more, getting closer to our 2019 level. So that's good. That's a sign of sort of overall not as many people coming to the emergency department. That's one of the things we'll be tracking, and we want to see that come down and be in line with 2019. But then look at the bottom graph. This is where we pull out people who are over 65. And so again, the lighter line on the bottom of 2019 shows you, compared to the darker line in 2020, you can see that we were having more people over 65 kind of coming in January, again, kind of a bad flu season. But then look at what happens in March. We really see this big increase, and that is COVID-19 all the way. And that is, again, reflecting that people in this older age category have really been disproportionately impacted. So we've been seeing a lot more visits than we normally would to the emergency department by people in this older age group. And we're just starting to see that trending down, but we're still a long way above where our 2019 data does. So we update this every day, we look at it, and it's, again, a way of sort of looking at patterns or syndromes across the city, separate from testing, separate from the very specific COVID testing. So we just hadn't talked about that, and I wanted people to have an understanding of what that syndromic surveillance was. Okay, so let's talk.
I just got a lot smarter.
You got a lot smarter? Yeah, you watch
great.
this every day.
All right.
Yeah, by the way, if people really want more science, look at what we did on Saturday. Because all day on Saturday, we had very technical questions about mutations. And so we spent all day on science on Saturday. But today, we want to talk about transportation especially.
Yeah.
So thank you again so much for being here. And go ahead and just tell us a little bit of how the work of your department has already started to change as a result of COVID, some of the big things you're thinking about.
Yeah, and we're a lot like many organizations, whether you're a city department or you're a business. We sent a big proportion of our workforce home. We're teleworking.
Yep.
So about a quarter of our folks are teleworking. And then the other part are working in the field. So we do a lot of construction. So whether that's filling the potholes that are really important to do, the curb and gutter work. If you've been down Michigan Avenue, you can see that we have massive projects going. It might feel like a hassle when you're out there, but it's a lot better now in terms of traffic being about 50% of what it normally is.
Right.
So we've been able to really expedite major construction
Glad
projects.
to hear you're I was hoping taking advantage of like fewer cars, get some of that street work done.
We're taking advantage of it. Don't worry. And so like the hassle you might see when the Montrose Bridge, let's say over the expressway, was coming down. Imagine if we were at full traffic levels when that's happening. So we appreciate all the patience that everyone has, but it's really critical that this work gets done, and that when we're back out and about, that the streets and the roads are safe and looking great, and that they are the public way you want them to be.
Yeah, absolutely. So what kinds of concerns have you seen?
Yeah, well, I think we care, like everyone does, about what life is like on our streets, and we're at a special moment right now where we need to stay at home.
Right.
And so we're observing, I think, what everyone is, which is there are moments that we do need to go out, whether it's to the grocery store or to take a short walk. We have an active Chicago community of folks who like to walk and run and bike. And we're trying to help folks navigate through, okay, if I do need to go out, if it's truly essential, what do I need to be doing?
Right.
What do I need to be wearing? And knowing that, our city is built the way it's built. How can we make sure that we have the most easy way for people to accommodate what they need to do in the public way?
So let's talk a little bit about this, because people love to ask questions about this, about, it's like, especially as the weather's warming up, we get questions in really every day almost about what should I be doing to be safe if I'm out and I'm walking and I'm biking, or like, talk to us about some of that from your department's perspective.
Yeah, and so we're definitely looking at a couple of things. One, we obviously understand we have the widths of our public way. Our sidewalks are a certain width. We have bike lanes. We have streets. And while traffic is down, so it's better than ever to take advantage of the bike network, we're certainly seeing folks trying to find their way. So we have folks who might be running in a bike lane, folks who might be trying to all run in the same place at the same time.
Yeah.
And so we're recognizing those kinds of things. And so, we've been thinking about what are some of the advice that we could give folks who are doing that. And I think some of that really started, and I defer, of course, to you, Dr. A, but some of that really begins with let's take care of each other and be conscientious and be polite and make a little room on that sidewalk. If you're a runner, you don't have to barrel through the folks who are waiting in line 6 feet apart to get into the grocery store. Find other routes. For instance, our big retail corridors, those are great examples of where, as we have a little bit of activity, curbside pickup and drop-offs, that's where the activity is going to happen. So, we'd like to tell you, if you're going out, pick a route, right? And the route you should pick is pick your residential streets, pick the quieter streets, pick a time of day that's a little bit different. All of that is going to make it a lot easier when you're out there.
And this has been, a lot, especially for our runners and our people who like to do this. And, we've certainly gotten a lot of feedback about the lakefront, and I'm sure you have as well. But really this idea of how can you alter your plans to not be within 6 feet of others as much as possible, and sort of be out and getting where you need to go, but how that can play out.
Yeah, and myself, I'm an avid cyclist and runner.
Tell people about your
shout out to Triple X Racing cycling team. But one of the things, for example, a lot of the cycling clubs, they're not doing their group rides.
Right.
And they're transferring some of their activities all online, doing group workouts, using Zwift, those kinds of things.
What's Zwift?
So Zwift is a pretty awesome tool for people who can bike indoors, and it's an online application, and you can bike with your friends. You have little avatars, and you can talk to each other through your computer and bike. Now that's not accessible for everyone, and we get that. But people are finding a way, and we recommend that you find those ways to be separate together while you're doing that. I think other things, for example, I wear a mask when I go for a run. It's not great. It gets really gross. But if I see people coming down, I put the mask up just out of politeness, and I'll also I'll stop and make room. Right? You don't have to hit your 6-minute mile time today. We know you need to get out. Give a little space. Give a guy a break. Step aside. That's what we're good at in Chicago, right? We're a polite city. We're a kind city. We take care of each other. Just do it in the public way too. There's some common sense stuff here, I think.
Yeah, absolutely. I think I was out taking a walk yesterday because the weather was nice, and people were, by and large, I think they're trying, doing a good job and trying to keep the distance. And it's so much of this is about not being in a hurry as much,
Yeah.
I think, actually.
Yeah, that's a great
It's sort of a
point.
moment for where can I adjust and think about where that fits in. So, all right, let's see what we've got coming in terms of some questions.
Yeah, and while you're looking, I
Yeah.
think on that line, whether you're walking or running or on a bike or in a car, it applies to everyone. So we get it. Sometimes folks are seeing there's a little more room in the street and you're running in the street. That's not ideal. We prefer that you run on the sidewalk.
Yeah.
You know, but if you're a car and you see pedestrians in the street, it's okay to stop and slow down. We're seeing traffic in terms of speeds are up 10% across the city, and that's very concerning. And so we need you to think about how fast you're going. It feels easy to speed because there aren't a lot of cars.
Right.
And congestion that we all hate actually helps you to drive slower. So
Right.
without it, you got to monitor yourself. Don't be on the phone. Don't be texting, and
Right.
slow down.
Right.
Just give a guy a break.
You know, it's interesting. When I'm coming in, I come in sometimes by car
Yeah.
on Lakeshore,
Okay, yeah.
and at that curve, like multiple days in a row, seeing cars that had crashed,
Yeah.
like at that curve, because we're so used to having so much traffic that you have to go slow.
Yep.
But people,
They're hitting things.
They're hitting
and we're
things.
seeing an
Are you?
increase
Yeah.
in the what we call the kind of fixed object crashes. So that's hitting a curb, or that's
Yep.
hitting a stop sign, or a traffic light.
Yeah.
You got to slow down, take a breath. Right.
Yeah.
Again, it's like just be the best of Chicago in this moment, which we
Yeah.
are. Just take a little space, take
Yeah.
a little time.
there's
don't be in a
there's an
hurry.
analogy in that, like
What is
somewhere
it?
around stay at home. You know, it's
Right.
like take some time,
Right, yeah.
like similar when you're driving.
Yeah.
All right, we're getting lots of questions.
Oh, man.
Jeff Hutchins, we've touched this a little bit, but he says, please address runners. Some run up behind with no warning, huffing and puffing and
Yes.
spitting. So I think this is a little bit, do you
Yeah.
want to chime in on that a little
Yeah,
bit?
I think that's it, right. So, let's, again, we're in a different time right now, so just take it easy. It's helpful, one, if you're the runner, right, the person in front of you, they can't see you coming. Slow down a little bit, look for ways to, be less close to them. We get it that some folks are running in bike lanes. If you're going to do that, the preference is that you run with traffic, not against it, so a car and a bike can anticipate what you're doing. But again, stay on the sidewalk and just slow down. It's okay. You could stop and actually just walk
Yeah.
around a person. And even give them a little notice. Hey, I'm behind you.
Right.
Again, just going back to common sense and being polite.
Right, and not group running.
Yes, no group running.
No group running. Karen Allen Buford, is it true that while outside your home in public places, you have to have your hair covered? No, you do not have to have your hair covered. This is
Oh, thank God, because I got a mane here. And no haircut.
Yeah, this reminds me. We got a question this morning from staff around barbershops and those being open. All of us are recognizing that some of our hair is a little bit longer than it might otherwise be. But no, you do not have to have your hair covered. The recommendation and that really the requirement, if you're not able to keep a 6-foot distance now, to have that cloth face covering in place, is your nose and mouth specifically, because it is about your germs getting out. That is actually
Right.
the main role that is helping protect against. And so the germs don't come out from your hair, and we do not have concerns. We've talked about this previously, major concerns about mite germs getting your hair. Remember, coronavirus gets in through primarily your nose and your mouth, potentially a little bit in the eyes. And so the whole point of the hand hygiene, the whole point of being careful when we're touching things, wash your hands before you touch your nose and your mouth. You're good. The germs will not otherwise sort of, jump in there. Most of it is about really the interaction that you're having with living, breathing people is by far the bigger concern.
So now, if you're going out, pick her out and don't let the germs out.
There you go.
All right, we got it.
I like
Marketing
it.
Wizards.
Marketing wizards. Maybe we could put that on the crosswalks.
All right, there you go.
All right. So, So Scott Rubin here here's a question for you.
Yeah.
What is CDOT's position on open streets? Many cities have started to create decentralized local open street networks for pedestrians, families, and cyclists, and permitting only delivery, residential, and emergency vehicles without police intervention or drawing crowds. Do you want me to read that again, or you got it?
I think I got it.
Okay.
I mean, I'm really glad this question got asked.
Yeah.
So, yes, to the Facebook universe and everyone else, we are really closely examining all of these cities. We are taking that question very seriously as we are also making sure that whatever we recommend and end up doing is in keeping with staying at home and being safe.
Yeah.
And so if you look at, say, a city like Oakland that closed 73 miles of residential streets, part of it, that sounds great, but part of the way that we like to plan in Chicago is being really attuned to each individual neighborhood. It's very important, I think, for us to recognize that what we're seeing in terms of COVID, what we're seeing in terms of where people live and housing patterns and open space across the city, it's all different.
Yep.
And so we want to take a really measured approach and say, okay, if a neighborhood raises their hand, is experiencing some issues, we have lots of tools that we are happy to talk about how we can apply it. Now, a couple of things.
Yeah.
One, whatever we do has to be meaningful.
Yes.
So we are not doing this just to say that we did something.
Right.
It has to be addressing the problem as the problem's been identified through local knowledge and local know-how, and then whatever expertise we can bring.
Yeah.
I think the second thing is to that other question about, or embedded in that question, is capacity.
Multiple things.
Right?
Yeah.
We do not have the capacity to stand in front of every entrance or every cone that might be blocking a street to tell you not to go down it if you're a car, that kind of thing.
Yeah.
And so whatever we do, we cannot take away from the other obligations of city employees to do the work that they're doing.
Yeah.
So enforcement needs to be really a construct of what communities can do together. And so that's why the third thing is really important, that this is a community engaged process.
Yes.
So one of the things that I'd like to offer is we've set up an email.
Great.
We do want to hear from Chicagoans about what you're seeing and what you'd like to see happen. Again, we care about the fact that one solution isn't going to work everywhere. So there's an email address called COVID Mobility at cityofchicago.org.
COVID Mobility at cityofchicago.org. We'll
Yes.
make sure we put that in the links.
We'll put that up. And send us a couple of things. What you're seeing, and the intersection, the nearest intersection where you're seeing this occur. Some ideas that you might have. And then anything else you want to tell us about your experiences on streets and sidewalks, that sort of thing.
Great.
It's our goal really to listen really well, and then we'll respond with some tools and some ideas as we go forward.
Yeah.
But bear with us. Again, it's important that we are making sure that whatever we decide to do, it's right for Chicago.
Yeah, absolutely. And I think from my standpoint, we're interested in where some of this has been put in place, really looking at the data, like what has been the impact. We're thinking about this, this is not just a May issue here. This is going to be something that's going to be with us. We're really planning at the health department in a multi-year kind of way, where you think about the vaccination campaign. Like, this is something that where we are thinking about things like this. We want to make sure we're hearing from folks. We want to make sure we're applying actual sort of local solutions to the issues and doing it in a way that makes sense. So.
Yeah, and of course, we definitely, as a Department of Transportation, we love it when you walk. We love it when you bike and take public transit and all of those things. And we want to make sure that we are continuing to move forward on the questions we were already talking about, right? How do we make streets feel open and safe and inviting? Because I think, as I said at the beginning, streets and sidewalks are where you move, but they're also where you are in place, right? It's part of your public realm.
Right.
So have faith. We are looking carefully at this, and the same way that we've addressed COVID, we're not going to jump ahead. We're going to do things in the right measured way, one step at a time. So again, COVID Mobility at cityofchicago.org. Send us what you're thinking. We're excited to hear about folks' experiences.
Okay, perfect. All right, so someone here wants to know, what is the latest with Divvy?
Oh, great. Yeah, Divvy's great. So we have extended a really important offer where we cut membership prices in half. That'll go again through the end of May. So a Divvy membership's usually for a year long, it's about $100. It's $49.99 right now. So please sign up for that. We love that folks are taking Divvy. We also are offering free rides for healthcare workers. So if you are a healthcare worker, you can go through the hospital system that you're working within. There's a special code that we can get to you, so it's free rides.
Great.
We're doing $1 Divvy. So Divvy's normally about $3 for a half-hour ride. You take it for $1. That's making it as easy as possible. We want you to try it out if you haven't, and make it easy for an essential trip. And then I think one really important thing is we have a program called Divvy for All. So for folks that fit into particular low-income brackets, you can get a Divvy membership for a year for $5.
Awesome.
And now you can do it online, and that's a change that we made in response to COVID. We recognized that we had to make that easy. We'll have more to say on Divvy shortly.
Okay.
We've got some super exciting things to roll out this spring.
Yeah.
So I'm not going to reveal it yet, but know that that kind of mobility has always been a part of our future, and we hope that we can do what we need to do in terms of infrastructure and programming to make that still as accessible as possible.
Yeah, I have a Divvy membership. Like, I love Divvy because there's one right near my home, and I love to take it. But I think especially now, where people are thinking about how can I transport myself in a way that is good for me. We talk about people. I want people to be getting their heart rate up every day for building strong hearts and lungs and just kind of generally being healthy. And at the same time, how are people getting transported, especially people who need to be out for essential reasons and using that. So good.
Yep, and I should say that the bikes are cleaned often.
Good.
So know that as they're being changed out, they're being wiped down and all of that. So obviously you should take the precautions you would do in anything, but know that that's also part of the attention that we're given to the program.
Yep. And in the same way, if you're riding a Divvy or you're out, you're doing things, just make sure you clean your hands before you touch your nose and your mouth. Not then a concern in terms of transmitting virus. So, all right, good. Let's see. Here's one probably more for me. Donna Scafidi Cameron from Facebook. Is it true if you got a flu shot that it can give a false negative? It is not true. So flu shots, remember, are for influenza. And influenza is a completely different kind of virus than coronavirus. They are not even in the same family. And so I love that you got a flu shot because that made you much less likely to get influenza, and especially where we'll be looking ahead to next year, where we're looking to our flu season in, starting kind of October, November, December. It will be very important that people are getting their influenza vaccines, because influenza, as you even saw from that syndromic data that we were showing, in January, a third at least of our visits of people coming into emergency departments are people sick with influenza, and it's already a big stressor for our healthcare system. Where we think about our flu season next year with COVID on top of it, it's a major worry. So a flu shot in no way impacts any COVID testing. It does nothing for false positives. It does nothing for false negatives. It helps protect you against influenza. It does not help protect you against COVID. Okay. Let's see. Here, I'll take another one here. So Dahlia Radecki from Facebook. What happens once you finish your 14 days quarantined? Okay, so good question. So let's remind everybody, 14 days quarantined. Quarantine, again, means somebody who is healthy. So somebody who does not have COVID symptoms, but has been exposed to somebody with COVID. And so say you live with someone, or you've worked very closely within 6 feet, et cetera, to someone who's been diagnosed with COVID, you are then advised to quarantine for 14 days, to stay home. Even if you're an essential worker, stay home. And the reason, again, why we use 14 days is that it can take up to 14 days for someone to develop COVID after having been exposed. Most typically, people start to develop symptoms about 5 days after, but it can be as soon as 2 days after, and it can be as long as 14 days after. So once you have completed your 14 days, if you're fine, if you've not developed symptoms, if you've not had issues, you can return to all regular things. Now, regular things right now still includes the stay-at-home order. Yes, there's our social distancing. Very good. Perfect. Thank you, because we forgot to do that at the beginning. But if you're an essential worker, that's when you would be able to return to work, and there would not be any further restrictions on you at that point. So good question. Okay. What advice do you have for people who are using public transit?
That's a great question. And I think it's grounded in a number of the things that you've heard today, which is, you wear a mask, you use hand sanitizer, you don't touch your face and hands. I think the Chicago Transit Authority has done a lot of work to create rear boarding opportunities. Having the articulated buses, which is the fancy name for the double bus, where you get a little more room. And I think there's also that level of, let's be courteous. Again, don't sit right next to somebody, right? There's usually room. So make a little space at the bus stop when you're waiting for the bus to come. All of those things are precautions that you can take, and know that the CTA is working really hard to disinfect and clean buses, to make sure that drivers have the protective masks and things that they need, and instituting things that we do also at CDOT. We have hand washing stations. We make sure that we have crews that are in separate vehicles and traveling to job sites. Hand sanitizer, the rollout of masks again. We've done those kinds of things, and CTA is a big part of that.
Yeah, and we've talked a lot with CTA, like regularly throughout this, and we will certainly continue to. And I think even things, certainly, there have been a number of infections among their own staff. Like, these are essential workers who are out and about. Lots of work to make sure that when they are sort of operating their vehicles, for example, they are, we're only using the buses that have the like the plexiglass, the shield division, the rear boarding. Obviously, people who ride the L know that the operator there is sort of in a separate compartment. But there are a lot of folks who work for the CTA who are not just the operators, and what's happening in terms of yards and all of those pieces. But also lots of conversations, and we've been talking to people around the country too, around the L, for example, actually, because the doors are opening very frequently, the airflow is actually quite good through there. So what are you doing to really maximize airflow? What are you doing in terms of cleaning protocols? What are you doing in terms of making sure social distancing is happening on platforms? Like, this is it's been a robust conversation so far. Certainly as we start looking ahead to this summer, and as we start to open things up, really wanting to make sure that the CTA is as safe as it can be, and that people feel confident riding it is going to be a big part of the planning here.
Yeah, so. I mean, public transit is an important part of our present and our future.
It is.
It is how we will address climate adaptation and change. It's how we can make it possible to get people from where they are to the job centers where the jobs are. So it's really critical that we continue to use public transit, use it safely, know that the city and CTA, we're doing everything we can, but it needs to be part of our future.
Yep. All right, Kurt Lench here has a question for you, although it might be for both of us. But it's about, he's saying, is the river in Lake Michigan open for boaters from outside Chicago? I have an answer there. I don't know if you want to chime in anything.
You can go ahead and I can add some color.
Sounds good. So during the month of May, boating is not available here in the city of Chicago. So that would include the river. There is some language, if you want to go on the website, there's a lot of detail about this because people are able to de-winterize their boats. There's some guidance there from the Parks District and others. But in terms of actual sort of boating, it's not available here in Chicago. And that is somewhat different from other parts of the state. But again, during the stay at home, that is where we are. Anything else you want to add?
That's right. It's what's right for Chicago.
Yeah, it is. Okay, Cassandra Taylor, big exclamation marks. Please speak on the peak, meaning where we are. So, all right, so we are not yet at our peak here in terms of infections. One of the reasons why the governor made the decision to extend that stay-at-home order through the end of May is that we still are on the way up, if anything. We have seen slowing of that. That's where in midweek last week, we had a whole day devoted to data. We'll probably do that again later this week, where we really talk in a lot of detail about this. But we've seen that curve flatten. So instead of the very, very steep increase, we're at a point where it is broadly flat. But we need to be on the side where we're coming down on that. And the different models that the state's looking at, that the city's looking at, they all have slightly different projections there, but they all project the peak to be in May, okay? So not April, in May, which is part of why that stay-at-home order needed to be extended. I will say that as we're seeing more testing, we're following not just the overall cases, because that can be impacted a little bit by testing, but we're following our hospitalization rates, our ICU rates, and even the death rates. And all of those are also showing really good signs of flattening. But like the death rates especially, where there's been the most testing and the most the most easy in a lot of ways to follow over time, we've gone from those increasing every 3 days to sort of on about every 15, 16. And those can lag a little bit behind the cases, but we're not at the peak yet. And here's my concern. I'm confident that we will peak in May, as the models suggest, and we'll be on the way back down, and we'll be able to start carefully talking about reopening and what that needs to look like if we see people continue to limit new infections. And my worry is that we've already started to see our cell phone data that we track anonymously moving in the wrong direction. I know, sort of just from being out and around in Chicago, that we are seeing more people moving around than we were even a week or two ago. And my worry is, especially if that moving around is in a way that is putting people in contact with each other who otherwise would not be, if people are starting to read from around the country, states are starting to do some of this opening, and if people say, oh, I can start getting together with friends, does it really make a difference? I can start kind of having the play dates. Like, do I, you've heard the mayor talking a lot about parties, and we know that the weather's getting warm, and there's a very natural desire to celebrate that. But all of these projections sort of assume that as a city and as a state, we broadly continue to sort of abide by the stay-at-home order. So my biggest concern is that if we go back to normal before we are ready, sort of locally and here in Illinois, to do that, like every day that we have more cases and more people interacting with each other, it just pushes our peak later and later and later. And like, nobody more than me wants us to be able to start moving ahead. And there's you've heard the mayor talk about the amazing, recovery task force and plans and lots of details. But we've got to be on a side where we're not at risk of sort of seeing that big spike come again and overwhelming our healthcare system. So, I saw there was a meme that I saw that said something about ending stay-at-home orders or flattening the peak. It doesn't mean you go back to normal. It means there's an ICU bed available for you, And I want people just to please try to not change, not loosen things up just yet. I know it's hard, but so the peak is coming. I expect to see the peak in May. That's what the models suggest. And if people continue to, do all of these things, we'll see it sooner.
It's great.
Yeah. Okay. This has been flying by today. Question for you, and it's a more general one, but people know that we often ask this, is just any ways that COVID-19 has impacted or changed your life specifically, personally? Personally,
well, one of the things that when the schools closed, we had our kids who were already with our grandparents for the weekend go up there and stay there, and they've been there for about 5 weeks.
Okay.
And so that's really hard.
Yeah.
You're doing the Zoom call. We did a birthday party over Zoom, which probably half the country has done at this point. It's super hard.
It's really hard with kids.
And they've since come home, which means we won't be visiting the grandparents. We stood in the driveway and said, get in the car, and that's really hard.
Right.
So that's an adjustment. I think, part of what's so amazing about working in transportation is you get to be out and about and in public spaces and interacting with so many parts of the city, and that's just something we can't do right now. So we're doing the endless Zoom calls and that sort of thing, but I think what's been really gratifying is to see us get even better at some of the things we do, a little more efficient, to see the wonder of people adapting and figuring things out and really excelling as hard as it is. You do the meetings where someone's got a kid on their lap and there's like, you know, somebody walking by and all of that. And I've got to say, I have such gratitude for the folks that I work with, and I see it in every city department, who everybody's doing their best. And that's all you can ask. And so I think in terms of change, right, it helped me to see really the power of when everybody's kind of pulling on the same rope in the same direction, trying to like get through this together. That's had a measurable change.
Love it. Wonderful. And we really, you know, I know your department, like mine, is thinking about COVID, but then how that COVID response can actually change for the better what we do sort of as a city and as government, and like how to kind of do this better.
Right,
so.
like what kind of a city do we want to come back to? What is, I think, as the mayor said, what is the great renaissance of Chicago? How do we move forward together? Those are questions we're asking internally in our department, but we want the whole city to be thinking about that.
Yeah, absolutely. All right, so we're coming up on the end here. We like to end usually. It was fast, I know. It's always time flies when you're having a good time. So thanks again, really, so much for coming in. Please, any advice for people, or you want to remind people of that email address maybe?
Yeah, I do. I want to remind, so we know folks are thinking about this. We want to hear from you. I mean, that's how we make Chicago great, by listening really well and then doing things that make sense at a neighborhood scale. And so please email us at covidmobility@cityofchicago.org. And tell us what's going on in your neighborhood as it pertains to streets and moving in the public way and all those things. And so we'll appreciate that if you reach out. Take advantage of Dollar Divvy and our half-price memberships. As I said, we will have some exciting news about Divvy shortly. But please, you know, bike and walk and do those things if you need to in the safest possible way. And I think at the end of the day, it's, you know, again, if you're going out, plan your route, don't let the germs out, and be kind to each other. Because I think if we kind of lean into, we have to care about each other, you'll know how to act. You'll know how to make room, because that's how we get through this together.
All right, love it. So this is Commissioner Gia Biaggi from Chicago's Department of Transportation. I will just end, I think, with two pictures that we got. One was a chalk marking, speaking of sidewalks, that we can bring up that says April distance brings May existence. Hey, and I will just extend that to say May distance brings June existence. And really continuing to keep your distance in May, like we did a really good job of in April, is going to bring us to a point where we'll be not just existing, but starting to kind of think about what reopening looks like, and sort of have some opportunity to start thinking beyond COVID, which I know we're all so anxious to do. And then the last picture that we'll show was from over the weekend. This is a picture of the Merchandise Mart, all lit up with our Stay Home, Save Lives campaign. People may know that the Merchandise Mart is always a place for digital art, and over the weekend, lots of Chicago buildings were lit up with that blue and white, sort of thanking first responders. And I just really like this picture as, again, a reminder that all of us should be staying home and saving lives. So thanks again for tuning in. Tomorrow we will be back just with our regular, with Sybil Madison and me. We'll pound through some more science-based questions, but really appreciate everybody's work hanging in there.
Can I say,
please,
on behalf of the city, we thank you and your whole team. You're doing incredible work. It is just, it's a marvel to watch, and we appreciate all you're doing.
Oh, I appreciate it. Yeah, everybody is working very hard at the City of Chicago and all the departments. So we'll see you tomorrow. Thanks again.
Bye.